What are the symptoms of psoriatic arthritis and what is their treatment? So before we go for the treatment, I must tell you one very important thing, that almost 50% of the patients who have psoriasis, they get psoriatic arthritis. And whenever there is a psoriatic arthritis, one notices that the joints get involved, especially the joints of hands, fingers, metacarpals, carpals, they get involved. The wrist and the ankles are the first joints to be affected, and they fuse together, and there is always bending and all these things of the joints, permanent damage in the joints. So one must be very careful in the treatment of psoriatic arthritis, and one must know the earliest symptoms of psoriatic arthritis. So whenever psoriatic arthritis begins, it doesn't begin like an arthritis. Usually these people notice in the beginning that when they get up in the morning, they get little stiffness of their body before psoriatic arthritis, and just they do some workout or they just start some day-to-day work, so gradually it disappears. That is we call as aggravation at the first motion. So in the morning they may get a stiffness in the back, stiffness in the fingers, and as they move on, it goes off. So this is an earliest sign of psoriatic arthritis, and where you should be cautious that before it settles on the joint, you need to take a proper care of that. Another important thing in psoriatic arthritis, we notice that gradually there is a pain or swelling of one or two finger joints, and they are really painful and they cannot move it. And then they come to the doctor, or they go and just have some anti-inflammatory or analgesic treatment, and they carry on like that. No, that should not be the only treatment in psoriatic arthritis. Of course, since it is painful, you can use these anti-inflammatory drugs. But at the same time, I also recommend that all those people who have psoriasis or who have tendency to psoriatic arthritis, that they do some regular physical exercise. By physical exercise, I do not mean that walking, running, going to the gym. So that is all involved the big joints, and that is helpful for your health in general. But since psoriatic arthritis affects the small joints, and usually we do not move the small joints regularly, even during the heavy exercises. So we need to do a special exercise of the hands and the feet joints, toes. So for example, I always recommend people to do the motions or have a ball, soft ball, and go on pressing it, and have this type of exercises and move each and every joint of finger. For example, these distal phalanges, usually we do not move it. So I always ask the patient to hold it like that and move it. So each finger joint should be moved. And you can do it while sitting idle, watching TVs, or traveling in the bus. So you do not need a special time for that to do the exercise, but you can have a habit of doing all these things like that, and wrist. So that is a type of exercise that can help you to move the joints regularly. And in the early stages of psoriatic arthritis, this exercise prevents the joints from getting fused. Even if there is swelling, don't just stop not moving the joints. Any amount of movement that is in the joints would help you to prevent the fusion of the joints. Once the joints are fused and they are destroyed, it cannot be again. Then you have to replace the joint with mechanical joint. So before this happens, actually these are the small things. Another very important thing, I always ask psoriatic arthritis patient that don't do heavy weight bearing exercises like running, jumping, all that. So whenever you have an arthritis, you have to protect your joints from the injuries because they are already swelled. So people, if they go on doing exercises and they feel that by exercise they feel better, and they do the sterness exercises, so they can damage the joints. So the exercises should be mild one, just moving the joints like yoga and other practices. You can do it during when you have a psoriatic arthritis. But movement of the joint is very important. If you don't move, you lose the joint. So in that case of psoriatic arthritis, this is one of the very important thing that you must note. So for the treatment goes, so initial treatment whenever I find psoriatic arthritis patient, so we start with the treatment, and if it is in a first milder phase, definitely it gives a good result. But sometimes the psoriatic arthritis is very severe and it takes time to control it. But when I control it, and if it takes more time, by the time I control it, one may have to lose his joints. So in order to save the joints, it may take a little more time in the period of the treatment, but saving of the joint is more important than the span of treatment if it is more. So in that case, I do a little compromise, that I ask the patient to start the allopathic treatment to control the psoriatic arthritis, at the same time continue the homeopathic treatment along with them. So whenever the homeopathic treatment takes the effect, gradually we reduce the allopathic doses, we taper down, and we take it all on homeopathic treatment. So it may take a little more time, but we do save the joints from its damage. So this is a compromised treatment in case of psoriatic arthritis, in order to save the patient's joints from the damages. So one has to do this, and there is a special treatment for psoriatic arthritis which we call as advanced treatment of psoriatic arthritis, because they need a special care and some advanced attention and some extra time and research on that is needed. So that is an advanced treatment, especially for the psoriatic arthritis. So in the later phases, in earlier phases, okay, we can try and control it in a regular treatment, but when the regular treatment does not give the result, we cannot sacrifice the patient's joints. So at that time, we strictly say that you need to go for advanced treatment, which is an essential treatment for psoriatic arthritis to save the joints and get the best results. So this is what the psoriatic arthritis, because in case of psoriasis, we notice that psoriasis may go to any extent, but it may not hamper your life directly. But psoriatic arthritis can minimize your motions or just stop your moving, and it can really hamper your life to great extents. And so one must be very careful in psoriatic arthritis. The earlier diagnosis, the earlier detection is the best way to avoid the complications. And sometimes if it goes very severe, you may have to sacrifice a few joints to the psoriatic arthritis. Complete cure may not be possible. So in that case, I always request all the psoriasis patients to be aware of psoriatic arthritis, to be careful about psoriatic arthritis. They may or may not get it, but one must take a proper care that one may not get a psoriatic arthritis. And in homeopathy, we have really a good cases. If we notice it at earlier, moderate and milder stages, we can help. But if it is really a severe case, then the help is limited, and we try our level best to give the best possible results in case of psoriatic arthritis. Thank you.